Hello, and welcome to the final webcast in our series about TBI and challenging behavior. This webcast focuses on planning interventions for students who have challenging behavior after traumatic brain injury. This webcast series is sponsored by the Wisconsin Department of Public Instruction. My name is Julie McGivern, and I teach at the University of Wisconsin-Madison. Before you view this webcast, please view the first 3 webcasts in this series. This content builds on the information presented in those webcasts. Secondly, you might want to download the document that's listed here, Intervention Planning Worksheet, especially if you're thinking about a specific student as you're watching. And finally, all the names of students who are used as examples in this webcast have been changed and identifiable situations altered to protect student confidentiality. If you are interested in additional information about TBI, please refer to the training materials listed here, which can be found on the DPI website. The goal of this webcast is to provide the viewer with a process for planning interventions for students with challenging behavior after TBI. Let's look at some examples of the kinds of challenging behavior we see after TBI. Joe is a 6th grader and he shoves in the lunch line. Dan is a 9th grader. He yells and throws his math book. Latoya is a kindergartner, and she's not initiating tasks that her teachers are quite sure she knows how to perform. And finally, Maria is a 3rd grader, and she interrupts other students as she wanders around the classroom. These are the kinds of behaviors that we often see after TBI. So why is it so important to intervene? We know that students with challenging behavior are at risk for several negative outcomes that are listed here. So our well-planned interventions are really intended to prevent these outcomes. I'd like to start our discussion of interventions by introducing the concept of behavior pathways. This may be familiar to you if your school is implementing positive behavior intervention and support systems. What we want to do is use our functional behavioral assessment, which we talked about earlier in webcast number 3, to identify the pathway that leads to challenging behavior. So I'll just briefly review this. We want to look at slow triggers and fast triggers that set the stage and then immediately precede the problem behavior that we're interested in. We want to look at maintaining consequences. What are the things that increase the likelihood that a behavior will occur again? And then we want to look at the functions. What are the needs that the student is meeting through the challenging behavior? Again, if you want more information on this, please look at webcast number 3. So here's an example of a behavior pathway that leads us to a hypothesis statement. When Joe is hungry and the lunch line slows down, Joe shoves the person in front of him. He's taken from the lunch line and given his lunch. The shoving allows him to get his lunch, to communicate his frustration, and to escape the lunch line. So once we've identified the pathway that's leading to the behavior that's a problem, now we can start to identify what we call a competing behavior pathway. So here we can do this in 2 ways. First, if you look at the upper row of boxes, we can identify a desired behavior that we really want Joe or another student to carry out instead of the problem behavior. And then we can adjust our slow and fast triggers and our maintaining consequences to use this more desired behavior to meet the functions that the student is trying to meet. Alternatively, we can identify a behavior that isn't exactly the desired behavior, but might be close to it, and it is an alternative to our problem behavior. It's going to be more acceptable to us than the problem behavior. And then we're going to try to adjust our triggers so that that behavior will also serve the function that the student is trying to meet. So when we've completed our FBA, and we've identified our behavior pathway, now we can start planning interventions to change the pathway. There are 4 categories of strategies based on the FBA that we're going to talk about today. We can talk about slow trigger strategies, fast trigger strategies, behavior teaching strategies, and these often address the functions of behavior, and then we can think about consequence strategies. So as we consider intervention, we want to think about the 3 goals that we're after here. First of all, we want to try to make the problem behavior irrelevant. We want to just eliminate the need for it by addressing the slow and fast triggers the student is responding to. Secondly, we want to make the problem behavior inefficient. We want to try to find a behavior that will work better for the student. And then finally, we want to make the problem behavior ineffective. We want to prevent the student from getting his or her needs met by using this challenging behavior. So as we now think about planning interventions, we're going to talk about 6 specific steps that we can use in identifying good, effective interventions. First of all, we want to identify the team. Who needs to be involved in planning our interventions? So remember that we want to include everyone who might be implementing the intervention so that they have a say in what this intervention looks like. We're also going to want to include anyone who can be helpful to us and provide information. So if we think about LaToya, our kindergartner, we are going to want to include all the teachers that interact with her and experience this behavior of her not carrying out activities that we're pretty sure she can do. We're probably also going to want to include her parents, because her parents likely may be encountering behaviors like this at home. They may have found some effective strategies, and putting our heads together is going to be very important in this case. So now that we have identified our team, we want to look at the specific goal behavior that we're after. So let's use Daniel and his math class as an example. So we've been looking at data about the challenges that Dan has experienced since he came back to school after his TBI. And we can see that he had some challenges in classes before his TBI, but now he's got more challenges in most of his classes, or at least some of his classes after TBI. But we can see that math looks like it's the place where Daniel's having the most difficulty. So we're going to decide to start with math intervention with Dan. So there are 3 things we want to remember now as we try to identify a goal for Dan. First of all, we want to look at the specific goal and target behavior, and we want to define them in positive terms. So for example, Dan will work independently for 15 minutes in math, or LaToya will brush her teeth in 2 minutes with only 1 prompt. Secondly, we want to think about, is the goal socially valid? Does it actually address something that's important that we want to bring about in the student's life? And then finally, we want to look at, is the goal reasonable? Can the student actually attain this goal? So on this slide are listed some prerequisites that have to be in place for a goal to be attained. And you can see that we have factors that are related to the student on the left and factors related to the environment on the right. After TBI, there are some specific factors that are student-related that we want to pay close attention to make sure that the student can carry out the goal that we are setting for him or her. First of all, we have to be sure that the student understands the expectation and is aware of and can monitor his or her behavior. We also want to be sure that the student has the ability to control his or her behavior. As we know, soon after injury, many students may have reduced behavioral control. We also want to be sure that the student has the skills in order to engage in the behavior and the motivation. In the environment, the factors that we need to pay attention to are, will there be opportunity for the student to practice the behavior? Is there enough reinforcement so that we can actually motivate the student? Will there be models of the behavior? And will there be positive setting events, slow and fast triggers that influence the likelihood that this behavior actually will be performed, the goal behavior? Another important consideration in setting goals is whether we're looking at what we call a skill deficit or a performance deficit. A skill deficit is when a student can't do what we're asking them to do. And a performance deficit is when the student won't do it. We think the student has the ability, but for some reason isn't carrying out the activity. So for example, LaToya's teachers think that she can brush her teeth and she can do these other tasks, but she's not doing them. So what we want to do is really carefully look at LaToya's behavior. We want to see how much support does she need in order to show this skill. Can she do it when she has adequate support? Does the setting matter for LaToya? Does she show her skill to a greater or lesser extent in different circumstances? The answers to these questions will help us decide what we're going to do in terms of intervention. So if a student actually can't do the skill that we want, of course what we're going to do first then is teach the skill. So for LaToya, we're going to have to teach her to brush her teeth or tie her shoes if we decide that she really can't do these things. If we're seeing a behavior that we think a student could carry out a skill, but they're not, now we're going to have to look at the triggers for the behavior, and we might want to use behavioral momentum. These are concepts that were discussed in earlier webcasts. But we're also going to think about providing positive consequences and addressing the functions of LaToya's behavior. Those are things we're going to talk about later in this webcast. But I'd like to talk for a minute about LaToya. In most of this webcast, we're going to be focusing on disruptive behavior or externalizing behavior. But LaToya's behavior is what we call internalizing behavior. She has a lack of initiation, and this is a problem that we very often see in students after TBI. It's important to remember that this lack of initiation is actually the result of injury to the brain, to the frontal lobes where executive functions are regulated. It's not necessarily triggered by a specific factor, and it doesn't necessarily even serve a specific function for the student. Also, we need to remember that this kind of initiation impairment may or may not be responsive to consequence manipulation. So we're going to have to think carefully about how to intervene with LaToya to help her learn to initiate this behavior. We can develop cues for her behavior, and then we can gradually try to fade the cues as LaToya learns new routines. So over time, manipulation of consequences might be effective for LaToya, but initially we're going to want to think about helping her, giving her as much support and prompting as she needs, and then gradually fading that support. Step number 3 is focusing on triggers in planning interventions. We have talked about that, and we've talked about it quite a bit in webcast number 3. So we're just going to mention that here we're looking to prevent challenging behavior. We're looking to identify the slow triggers that set the stage and the fast triggers that immediately precipitate a challenging behavior. We will talk more, however, about step 4. And this is focusing on the function of the behavior. In webcast number 3, we talked about some specific functions that students are trying to meet with challenging behavior. And a couple of these important functions include escape. Students often want to escape a situation, a certain task. They also might want to get access to rewards. And they also might be trying to communicate behavior. So the function itself isn't the problem. It's the strategy that the student is using that becomes a problem. So how can we help a student satisfy this need in another way? We want to help Daniel satisfy the functions that he's trying to meet in an alternative way using a behavior that's more acceptable to us. So what we often do in a situation like this is teach behavioral strategies in order to help the student meet the function in a new way. Now, I want to just make the point that often we want to hold off teaching new skills or sequences of behaviors to students if they're very early in the stage of recovery. It may not be the time yet for students to take in information and really benefit from that. Also, we don't want to be doing this behavioral teaching when a student is upset, when we're in the middle of a challenging behavior. We're going to want to try to do this when a student is more calm and when we have a number of factors to our advantage. So the two main functions that we're going to talk about today are communication of needs through behavior and escape. And so we'll start with communication. Teaching positive communication routines is something that can help us to alter challenging behaviors when they're used to communicate. So there are several important points that we want to remember about communication. First of all behaviors communicate. They may not be intentionally communicative, but if we look at them closely, we can see that they're telling us something. Secondly, behavior can become communicative based on how an adult reacts to a behavior. Third, when a student is persisting in using a behavior, we can bet that that behavior is actually adaptive for the student. It's helping the student reach his or her goal. When challenging behavior is used to communicate, now our goal is to teach an alternative way for that student to communicate that need. And we're going to want to include all of our intervention agents who are communication partners, because we're going to want to see some consistency in this new communication routine that we're teaching. So we're going to focus on 4 phases of teaching positive communication routines, and those are listed here. Our phase 1 is interpreting the challenging behavior. So we know that Dan yells in math, and he pushes his math book off the table. He's thrown his math book, and this occurs pretty soon after the teacher assigns some independent work. Our functional behavioral assessment has indicated that the functions of these behavior for Dan are escape from math and communication, that he doesn't want to do the work. So we'll think now about phase 2, deciding when escape and access are okay. So Dan's teaching team meets, and their goal is to try to figure out when it's okay for Dan to communicate that he wants to escape math class. So his math teacher says escape isn't okay. Dan needs to stay in math class, and he needs to do his independent work. So the team talks about this, and they look at their data, and they can see that Dan isn't doing any independent math work now. So as they talk this through, they decide with the math teacher that teaching an alternative communication strategy is critical. Since we're not getting anywhere now with Dan's independent work in math, we're going to focus on teaching a communication routine for him. And the math teacher agrees that for now, Dan can escape math when he communicates that appropriately. So now, in phase 3, we also need to ensure a large number of positive communication routines daily. So Dan's case manager is identified as the person who's, best works with him to teach him a process for saying no more math. So she chooses a quiet time in the morning when Dan's rested and he's usually calm and in good humor, and she teaches him how to indicate no more math. He can either say no more math, or he can use a signal. And the signal, if a student isn't verbal or finds it difficult to use verbal expression to communicate a need, might be a hand signal or something else that the student can use. For Dan's example, we might teach Dan to do something like this if he wants to show it's time for no more math. The nice thing about using a hand signal is that that can be incompatible with the problem behavior that we're trying to avoid. If Dan throws his math book or pushes his materials off his desk, doing this is incompatible with that. So it can help us out in that way. So Dan's case manager practices numerous times throughout the day, presents Dan with his math work, and then encourages him to show his sign or to say no more math. So continuing in phase 3, we want to have Dan experience practice, practice, and more practice. So now this is outside of class. The teacher is saying, this is practice time, Dan, but now the teacher is doing this with Dan and saying, here's your math work, and then the teacher cues Daniel. You don't want to do math? Show me how you say no more math. And Daniel gives his signal or says no more math, excuse me, and then the teacher says, good job, we'll do more math later. So now we're going to move that practice outside of class into math class. So Dan's teacher has to let Dan say no more math in math class so that Dan can see that this new way of communicating his needs is going to work. So now in our 4th phase, we're going to gradually reintroduce normal demands. We're going to start asking Dan to do work in math class. But first of all, we have to think about the other function that Dan's challenging behavior is communicating. It's communicating that he wants to escape math, and we have to think about why that is. What are the factors in math that are leading Dan to have this challenging behavior? So we're going to have to think about that before we can actually start using our positive communication routine. Let's finish talking about the positive communication routine, and then we'll come back to that escape function. There are several obstacles that people can encounter when they try to implement a positive behavior routine. First of all, it's important to remember that teaching communication routines is time-consuming. But when you consider the time that's lost due to challenging behaviors, it's often really worth our time to carefully teach a behavior communication routine. Some staff may feel that students will become spoiled if we teach them that they can escape certain tasks. But we want to help everybody understand that over time our expectations are going to increase. A third obstacle that we can encounter is that not all activities are negotiable. Students can't escape from everything. For example, taking medications. In those cases, what we're going to do is not allow escape, but we're going to want to create a routine that's quick and effective and just gets us through that situation that we can't let the student escape. And then finally, an obstacle can be that challenging behavior is sometimes unintentionally reinforced. If we're not consistent about making Dan use this positive communication routine, we might slip up and reinforce Dan for his challenging behavior. That's going to make it much more difficult for us. So it's important just to be aware of some of these challenges that you might encounter as you teach positive communication routines. So let's go back now and talk about the second function that we said we would mention today, which is the function of escape. Students often use behavior to express the desire to escape from a situation, and in Dan's case, he wants to escape math. So our challenge is to determine, why does Dan want to escape? What is it about math that he needs to escape? So we're going to look at factors like, is there a good instructional match? Is Dan's math work at his appropriate level? Is he having low rates of success, in which case we want to increase his rates of success? Remember, we talked about in an earlier webcast that we want rates of success to be 80 to 90% for students. Are there specific students in the class that are a challenge for Dan? Is it the teacher's style that's a problem for him? So we need to address these factors so that we can then gradually increase the demands in Dan's math class and then let him use his positive communication routine once these other reasons for his desire to escape have been addressed. Our fifth step in planning interventions is focusing on the consequences of behavior. There are several important considerations that we want to note as we think about consequence-based interventions with students with TBI. First of all, students after a traumatic brain injury have memory problems. They may not even remember the consequences that we establish for a behavior. They may also have slow processing and inattention, and this may reduce a student's understanding of the consequences that we present. The student also may not even be able to control the behavior, even if he or she wants to gain a reward. And that's especially true early after recovery. These factors might reduce the utility of consequence-based interventions in students with TBI. But if we think that consequences will be effective with a student, let's look at the kinds of consequences that we're going to want to use. We're going to want to use reinforcement, which is a positive approach to a consequence-based intervention. The definition of using reinforcement is using something that increases the likelihood that the behavior will occur again. So the positive reinforcement leads to a desirable consequence. A very simple example of that is if a young child is completing a worksheet and looking forward to the teacher's smiley face, that smiley face is a desirable consequence that increases the likelihood of the student doing the worksheet. Negative reinforcement, though, is when the student wants to avoid an undesirable consequence. An example of this might be if the teacher is going to put a frowny face on the worksheet if it's not done, that might increase the likelihood that the student finishes the worksheet. So both of these are intended to increase the likelihood that the student will actually do the work that the teacher wants. Now, it's important to remember, if our consequence intervention doesn't increase the goal behavior, then it's not a reinforcer. It doesn't matter what we intend a reward to do. If it doesn't actually increase the behavior we're trying to increase, it really isn't a reinforcer. So there are two things that we can think about to help us maximize the likelihood that our consequence interventions are helpful. First of all, we want to involve the student in choosing reinforcers if at all possible, because the student can help us understand what are the things that will make a difference for that student. And then secondly, we want to start with the level of reinforcer that we need. We may need to reinforce a student very, very frequently, especially early on. We may need to reinforce a student every 10 seconds. And then ultimately, we're going to move toward more random and intermittent reinforcement, which is a schedule that the student can't predict, which is a very powerful way to use reinforcement. So we're going to move likely from much more frequent reinforcement to thinning out our reinforcement schedule so we aren't reinforcing as frequently. Now I want to say just a few words about punishment. Punishment is something that is often done in schools, and sometimes there's reason to use punishment. But what we want to remember is that punishment doesn't teach the student what the student is supposed to do. Punishment is designed to decrease inappropriate behavior, and it may temporarily reduce target behavior, but it also may escalate the situation. For students after TBI, they may very easily be irritated and agitated, and they may escalate their behavior if punishment is given out. Also, we can have impaired student-teacher relationships when punishment is used, and we may be modeling anger and negativity. So let's just think about the example of Maria. Maria is our student who's wandering in the classroom, and she's interrupting other students. So the teacher says, Maria, you need to sit in the hall, and in 5 minutes you can come back into the classroom. Well, we haven't actually taught Maria what she's supposed to be doing when she's in the classroom. We need a more positive approach for working with Maria. So let's talk now about using reinforcement with Daniel, how we're going to do that. So Dan doesn't want to do his independent math. We've addressed his slow and fast triggers earlier. We already have math when he's not tired. His teaching is at his instructional level. And now we're going to be planning reinforcement. So we're going to meet with Daniel, and we're going to ask him what reinforcers would help him be able to just work even for 5 minutes in his math class independently. And he identifies getting a brief break to draw, getting a brief break to listen to some music on headphones, and maybe tickets to earn a snack after math. So Dan decides that it's the last one he really wants to use. He wants to try to earn some tickets to get a snack after his math class, just for working for 5 minutes. Now, if we're going to increase the likelihood that this works for Dan, we're going to want to be providing him very frequent reinforcement. For example, we might sit with him as he tries to do math work for 5 minutes, and we might be giving him tickets every 30 seconds or every minute, or if he's really distractible, maybe even more frequently. And we're going to be trying to lengthen the amount of time that he can sit as we reinforce him. So we're going to teach him that he's going to get these reinforcers, and then we're going to be able to provide him with a snack. Now I want to make one important point here about our using reinforcement. When we use reinforcement like this, we're rooting for the student to succeed. We want to be very positive about this, and we want to stack the deck in the student's favor. We're really trying to show the student that the student can be successful and they're going to obtain this reward that they're working toward. This is the way we're going to help them learn the behavior that we want them to learn. So we have to really think about making sure we have enough frequent reinforcement and that we're doing it with a very positive attitude for the student. So let's think about a few tips for using reinforcement early in a student's recovery after brain injury. First of all, we're going to want to keep that rate of reinforcement high. We're going to also want to keep the reinforcers visible or tangible. So even if we're able to use something like tickets, we want to keep them in a place where Dan can see that he's going to get those early on. And then we're also going to want to alter our reinforcers every once in a while to be sure that we're avoiding satiation or a student's tiring, losing interest in our reinforcer. Then later in recovery, we're going to try to use the smallest amount of reinforcement that works. We're not going to try and eliminate it, but we're going to use whatever works. We're hoping that we're going to be able to decrease that, though. We're also going to move to that intermittent reinforcement that I mentioned. We'll move also to secondary reinforcement like praise or a token economy, and then finally we'll fade to natural reinforcers that other students in the classroom may be receiving also. One other type of consequence-based strategy that I'd like to mention is self-management strategy. Using self-management is something that we can sometimes do later in recovery with students after TBI. And self-management strategies have 3 phases. The first one is self-monitoring, so the student observes his or her own behavior. The second phase is self-evaluation. The student then has to decide whether the behavior meets the criteria that we've set out. And then third, the student provides the reward. It's self-reinforcement. The student is giving him or herself the reward if criteria are met. Now, there are some very specific abilities that are needed in order to use a self-management strategy with a student. First of all, the student has to understand the expectations that we have, and the student has to be able to accurately evaluate his or her own behavior. We have to be sure that the student can tell when they are meeting the criteria and when they're not. So let's think about how this would work with Dan later on in his recovery. I want to talk about a specific type of self-management strategy called goal, plan, do, review. So Dan's still not enjoying math class, but he's been able to work with cues from his teacher, and now he's been able to work for 5, maybe 7 minutes. So we're now setting a goal that Dan's going to complete 15 minutes of independent work because we think he's moving toward that. So it's an ambitious goal, but we want to see if we can get him to work toward 15 minutes of work. So we create a plan with Dan now. And we decide that we're going to set a timer on his desk for 15 minutes, and then at the end of that, Dan is going to show his work to his teacher. So this is what Dan does, the do part. He works for 15 minutes, and then he takes his work to the teacher. Now, of course, early on, Dan might not be able to carry out this system independently. So the teacher is going to have to be monitoring to make sure that Dan is doing what he's supposed to be doing, that he's got the timer working. If he can only work for 7 or 8 minutes, maybe we readjust our goal. But then Dan is going to review his progress with the teacher, and they're going to talk about the use of the system. We're going to see, is it working? And is Dan able to provide himself with some self-reinforcement after he accomplishes the criteria that he has set for success? If you are interested in a more fleshed out description of using this type of self-management strategy, I encourage you to look at the Feeney and Ilvisacker citation that is referenced here on this slide. We're going to move now to our last stage in planning interventions, and that's evaluating progress. Is our intervention working? So why do we need to collect data to determine whether the intervention is working? Well, there are 2 important reasons. First of all, we have to see whether it is in fact working. Oftentimes we might think an intervention is working only to find that actually it's not. The behavior is still occurring, we're just not as aware of it. And then secondly, we want to learn whether we can even discontinue the intervention or alter the intervention. So if we're going to be collecting these data, we really want to use them to help us decide whether our intervention is working and whether we need to consider some alternatives. There are lots of types of data that we can use to help us determine if a behavior intervention program is working. We can use observations of the behavior itself and do frequency, intensity, duration recordings. In this case with Daniel, we now can see that his screaming and yelling in class is very rare and brief, so we think our intervention is working. We can also use already existing data like work completion in classwork and homework. We can look at attendance. We can look at office referrals. We can also look at observations outside of academic settings like lunch and recess. I want to just introduce one additional outcome measure that's called goal attainment scaling. And I want to talk about this just for a minute because this is being used increasingly in rehabilitation settings in students with TBI. A goal attainment scale is a simple way of identifying a target behavior, setting our goal, and then identifying levels of the behavior or benchmarks that the students might attain. So on this slide are two different approaches for setting benchmarks after identifying a goal that we have for a student. So on the left, you can see that we have a scale that goes from a -2 to a +2. And in the middle, we have a 0, which is our baseline. So here's where our current behavior is. So let's use an example of temper tantrums. Let's say we have a student who's misbehaving, exhibiting challenging behavior, and we are seeing, what we might call temper tantrums, a student, throwing materials, or a younger student, lying on the floor. If we have a base rate now of 3 per day, we want to recognize that that behavior could actually get worse as a result of our intervention. So we want to have room below our 0 to record the behavior if it gets worse. Maybe our intervention is going to lead to 4 temper tantrums a day. So we want to be sure that we can account for that. On the right side, though, is a scale from a 0 to a +4. And this side of the scale is what we would be using when we have a behavior that, we're starting where the behavior doesn't occur and we're looking to increase it. So, for example, in Dan's case, we could use the 0 as completing no independent work in math, and then work upward from there. So on this slide, you can see we have now benchmarks for Dan, and we've identified 6 benchmarks, so we have from 0 to +5, and each benchmark requires an increasing level of performance for Dan. You can see that this is a very quick tool to use. Dan's math teacher would just have to mark which of these Dan met in a class period, and that would be the extent of the outcome evaluation for the teacher. It would be very easy to use. Another advantage is that we can graph the outcomes that we're seeing, and this can even be helpful for Dan. He can see how he's doing using this intervention. So now let's just talk about putting it all together. Remember that most interventions for serious challenging behaviors have multiple components. We're going to want to be looking at the prevention component. We want to alter our slow and fast triggers. We want to look at consequence manipulation, make sure that our consequences are working in our favor. We also want to teach behaviors that will address functions, so that we're teaching things like positive communication routines. So early in recovery, we're really going to want to focus on our prevention strategies. We're going to alter triggers of behavior whenever we can. We're also going to want to use some of the strategies that we talked about in webcast 2, like classroom routines, positive staff styles, graphic organizers, and we're really going to have as our goal preventing this behavior from occurring in the first place, because it's much more difficult to intervene and develop an intervention once a behavior has actually occurred. Now later in recovery, we're still going to continue to use our attention to slow and fast triggers. We're going to continue our appropriate instructional match and other things that are important for all students. And we're going to now teach our communication routines and other things to address functions if the student is ready to do that. And finally, if we think they can be effective, now we're going to move to using reinforcement or managing the contingencies that a behavior brings about. And we're going to add in some self-management strategies like the goal, plan, do, review strategy that we talked about. I'd like to make 2 additional points here about interventions that go beyond the psychosocial interventions that we've been talking about today. First of all, it's important to remember that many students after TBI are on medication. So we're going to want to be aware of this. We're going to want to think about the side effects, and we need to communicate with families to be sure that we understand any changes in medication. Secondly, some students who have severe disruptive behavior after TBI need crisis plans developed for them. So this will be important to do when we see that a behavior can escalate and perhaps be a danger to a student or someone else. It's important to get some professional training in crisis management if you expect that you'll be working with a student with TBI. Be sure that has a severe challenging behavior. So be sure that you understand well what those components of a crisis plan are. Finally, on this slide is a summary of some of the characteristics of good intervention plans for challenging behavior. And I'm going to highlight a few that are particularly important for students who are coming back to school after TBI. First of all, we want to consider the students' limitations that occur as a result of the TBI. We want to look at things like executive functioning and memory that we talked about in an earlier webcast. Secondly, we want to think about the student's stage of recovery. Is this early? Is this late? Which kinds of strategies are going to be most effective for us? We also are going to want to target prevention. We're going to want to really think carefully about ways to eliminate challenging behavior from even occurring. And we're going to want to be positively focused. We're going to need to add in supports for students and be very positive as we're working with the student to bring about a change in challenging behavior. And finally, I just want to note that planning effective interventions can facilitate the long-term success that we're interested in seeing in students with TBI and all of our students in schools. This is a reminder about the webcasts in this series. Please feel free to go back and look at other webcasts if you haven't looked at the earlier webcasts. And finally, if you have any questions or comments, please address them to the contact on this slide. And thank you for your time and attention to this important topic.